Determining the effects of neuromuscular and proprioceptive exercise programs on the rate of non-contact ACL injury in collegiate soccer players. Anterior cruciate ligament, or ACL, is from the anterior intercondylar area of the tibial plateau to the medial side of the lateral femoral condyle. It has two bundles, the posterolateral and the anteromedial bundle. The ACL prevents anterior translation of the tibia. An ACL injury is common among football, rugby, volleyball, and basketball athletes. The non-contact mechanism of injury usually happens when there is an abrupt deceleration or a sudden change in direction. A valgus stress applied to the side of the knee to a planted foot could also injure the ligament. An ACL injury could be suspected if there is a popping noise from the knee and if a person feels that the knee is given out. Other symptoms may include pain, swelling, loss of range of motion, tenderness, and discomfort. There are various tests to diagnose an ACL injury. It could be done manually or through an imaging device. Management of the injury could be done conservatively and surgically. It is important to diagnose an ACL injury ahead of time so that rehabilitation of the ACL will not be delayed. Delay of management may result to longer rehabilitation of the ligament, which may postpone the athlete's return to play. Our study's objective is to evaluate the effectiveness of neuromuscular and proprioceptive exercise programs on the rate of non-contact ACL injury in collegiate soccer players. The study is quantitative, analytic, and experimental in nature. So we recruited 60 collegiate soccer players for the study. Inclusion criteria consisted of collegiate soccer players with a history of ACL injury in the past 2 years, and our exclusion criteria consisted of soccer players who currently have an ACL injury, soccer players without history of an ACL injury, and soccer players who had an ACL injury in the past 6 months or in the past year. We used purposive sampling because of the inclusion criteria. We utilized both descriptive and inferential statistics for the study, and have set the alpha at 0.05. The statistical tests that we have used for the descriptive and inferential were measures of central tendency, specifically the mean, and independent t-test, respectively. We also used pie graphs to present the distribution of the results and demographic data. So we divided the participants into an intervention and a control group. Subjects in the intervention group performed neuromuscular and proprioceptive non-contact ACL exercises for 3 weeks, while the control group performed standard care for 3 weeks. Incidence of the injury was assessed during the season. Most of the players were 22 and 18 years old, followed by 21 and then 20 and 17, and the least were 19-year-old players. We assessed more male players than female players, 52% for the males and 48% for the females. Types of ACL injury were mostly grade 1, followed by grade 2 and then grade 3. The variables were age, sex, type of ACL injury, and players with history of ACL injury, and these variables were acquired by interview. The psychometric properties were not applicable. So for the intervention group, 64% were not injured, and 36% got injured. And for the control group, 61% were not injured, and 39% got injured. For the outcomes, the p-value of the age, sex, type of ACL injury, and players with history of ACL injury were 0.16, 0.23, 0.88, and 0.33 respectively, and we decided to not reject the null of all these variables. For the participants, the strength is that the sample size made it convenient to distribute the intervention, while the weakness was that the sample size leads to a larger standard of error. For the methods, the strength is that the random selection made the study non-biased, while the weakness was that the interviews consumed a lot of time. The application of neuromuscular and proprioceptive exercise programs to collegiate soccer players had no significant effect, in the number of non-contact ACL injuries acquired by these athletes. The small sample size utilized may have contributed to the poor results. The researchers therefore conclude that further studies must be conducted in order to truly evaluate the effectiveness of neuromuscular and proprioceptive exercise programs on the prevention of the occurrence of non-contact ACL injury among collegiate soccer players. The researchers would like to conduct further studies about the topic in order to help athletes and sports scientists alike in decreasing the prevalence of ACL injuries.